Welcome to the Mental Breakdown. I'm Dr. Berney Wilkinson, and today's podcast is about the feeling of being trapped. But before that, let's do a little bit of housekeeping. As always, I'd like to remind you of the Handbook for Raising an Emotionally Healthy Child, Part 1, Behavior Management. The book is available on Amazon Kindle. It's a great resource for parents of children of all ages from birth through adolescence. Helps you look at typical behavior versus atypical behavior and helps develop some strategies and structure to make sure that you are able to limit the bad behavior and maximize good, appropriate behavior. The Elimination Diet Manual is also available on Amazon Kindle. Great resource for looking at whether anything in your diet may be affecting your physical or mental health. 38 days is all it takes to really go through the diet and look at those 7 usual suspects to see if they're having an impact on your health. The Parenting Your ADHD Child course is available on paideallc.com. Again, it's a 21 lesson course that has over 5 hours worth of lecture talking about what is ADHD, what does it look like at different stages, what are the medical treatments for it, and of course a lot of lessons on the non-medical treatments for ADHD and raising a child with ADHD. So check that out. Go to paideallc.com, click on courses, and see what you think. There's a whole outline there that walks you through, and so you see what each lesson covers and what it includes and all that information. So I hope you enjoy that. All right, I think that's all of the announcements. So we're going to get to the podcast. Again, podcast is all about feeling trapped and what we can do to get out of that. Enjoy. Dr. Berney. And, one of the most challenging and frustrating things that we experience in life is the feeling of being trapped. Now, whether it's feeling trapped in a relationship or based upon where you live or feeling trapped because of your job, when we feel trapped, we feel confined and restricted. And in general, we're just limited. We just can't do or feel we can't do some of the things that we want to do. Now, I experienced this probably about 10 or 15 years ago. At the time I was working at a university, and I loved working at the university. I loved teaching. I loved seeing patients. I loved doing research. I really enjoyed all of the stuff that I was doing there. However, it was really challenging because as the university I was working at was shifting to focus much more on research, the expectations that were falling on me and some of the other assistant professors working there became much more challenging. Not only were we expected to see 30 or 40 patients a week, we were also expected to write huge research grants and conduct research with hundreds of study participants and apply for huge NIH grants. Of course, all the while recognizing that less than 1% of people who apply for NIH grants do not get them, but this pressure to basically work 2 full-time jobs, 30 to 40 hours of patient care, and along with another 30 or 40 hours of research, it was just very overwhelming. And I felt confined because we tend to, especially when we're in a job that seems secure, it seems you get a routine check, you have benefits, you have these things that are there, it feels stable. And so even when we're unhappy, we feel like we have to stay there. And that feeling of being trapped, that feeling of not really having any options is ever present. And it's very challenging because it stifles some of our creativity, and it makes it very difficult for us to function and do some of the things that we need to do. But let's talk for a minute about what it means to be trapped. What are we saying when we feel we're trapped and we're stuck in a certain place? Well, the first thing is, what we're suggesting is that there's no escape. Now, that may seem very obvious, but again, let's think about what that means. There's no escape. What you're saying is that there is no way out. You are there and you have no choice about it. You're in this situation and you are confined and you have no options. That is a really scary place to be. Whether it's where you're working or a relationship that you're in, feeling as though you have no way out puts you in a very precarious situation. Because what that means is that other people can treat you however they choose to treat you, and we tend to experience various levels of abuse and challenging interactions with others simply because we feel as though we have to tolerate it because we don't have a choice. We don't have a way out. We don't have an escape. So we tolerate and we take it and we can take on all this additional stress and these additional issues simply because we don't feel as though we have any other choice. So we don't have any options, or at least we feel like we don't have any options. This is just our lot in life. This is just where we are, and we have no way out. We have no other options. Now, the second thing that it's saying is that we have no control over our environment. Now, again, that is a very uncomfortable and depressing state to be in. To be in a scenario where you feel that you're being forced to do some things that you don't want to do. You're being forced to be in a situation that you can't escape from, that you can't get out of. And then all the while, feel as though that you're there because somebody else is making you be there. Somebody else has control over various aspects of your life in that way. That's a very concerning situation and position to be in that oftentimes leads to depression, certainly stress and anxiety and other mental health issues. So when we don't feel as though we have a way to escape, we don't have any options to get out, we feel like we don't have any control over our lives. And when we don't feel like we have control, again, that is really the root and the basis of anxiety and other mental health issues. The third thing that it says, and being trapped suggests, is that we're the victim. And this is sort of a combination of the other things that I mentioned, the can't escape, the no options, and the no control. When we feel as though we're the victim, we tend to place ourselves in situations where we assume the victim role. We take on and we begin to view ourselves that way. Well, I just can't do anything else. Well, it figures that things would work out that way for me. It figures that, that's just what I deserve. That's just what should happen to me. And when we begin to have those kinds of views of ourselves, again, it really breeds and fosters depression, low self-esteem, hopelessness, anxiety, stress, worry. It breeds all of those really negative feelings that we tend to have for ourselves in those times when we feel as though we're trapped and that we have no way to get out and no help for us. So when we experience this feeling of being trapped, we have all of these emotions and thoughts and feelings going on at the same time, whether we're cognizant of it or not. Going back to my story of when I was working at the university, I certainly felt trapped. I enjoyed tremendously some of the people that I worked with, some of the things that I was doing. But every year when I went for my performance review, or every time, well, it wasn't every year, it was every quarter we had to do a performance review. And every time I met with, people who were my superiors, the people who were over my department or over my division, whenever I met with them, there was that sense of anxiety that, what are they going to have me do now? What's next for me? And that's really, really an anxiety-provoking situation because, again, you feel like you have no options. You feel like you have no choice in the matter. You just have to do what they tell you to do. And it's very, very challenging, very, again, anxiety-provoking and depressing. So I'm going to ask this question for us to consider through the remainder of this podcast, and that is, are we ever really trapped? Are we ever really in a situation where we have no options, no choices, no way to get out, where we have to be the victim? And my challenge to you is going to be to answer that question with a resounding no. We are never in a situation where there are no options, where there are no choices. We are never really trapped. Now, certainly our options may be limited, and we may not like some of the consequences of our various options. But there are always options. There are always decisions that can be made. For example, when I was at the university, I could have always left. I was licensed. I had colleagues and friends working in the community. There were lots of other things that I could have done. But I didn't feel as though those were realistic because we place some limitations on ourselves at times, and we keep ourselves from exploring some of these things. We'll talk about some of this in just a moment, but the options were there, even though I didn't feel like I had any options. I felt like that was just what I was meant to do, what I needed to do, and I had to deal with it and cope with it. But the reality is that there were options, and I just needed to better explore those options. So the question then becomes, if there are always options, if there are always other possibilities for us, what keeps us from seeing them? What keeps us from using and implementing these things? Well, I think there's three things. One is sometimes we're just blinded. Sometimes the options are there and we just don't see them for whatever reason, either because we're not looking, or because we are ignoring them, or because we just have to walk around one little corner and there it is. But for some reason, we aren't walking around that corner. We're just staying focused straight ahead on what we have to do. Usually it's not even straight ahead, it's straight down, looking at the desk at what we have to work on. We fail to look and get our eyes up and look around and see what we need to be doing. So the first thing is that oftentimes we're blinded to the other options that we have. The second thing is actually a psychological defense mechanism that we tend to use, and that's called rationalization. And what I mean by that is we tend to rationalize why we're in this situation, why we feel we're trapped. Well, you know what? It's just what has to happen. This is just my time where I have to go through this. Now, that time could last 10 years, but we just say, well, that's just the time that we have to deal with. It's just what we have to do. Or we rationalize it, it's not all bad. And that was certainly something I said when I worked at university. It's not all bad. I like the people that I work with, and I like some of the things I do, and I certainly like working with my patients, and I kind of like some of the research I'm doing, and every once in a while I get to teach, so it's not all that bad. But of course, the next time the meeting comes up, I think about, oh my gosh, this is terrible. I hate doing this. Sometimes we say, you know what, if I just stick to it, eventually it will get better. Again, that rationalization that we have to go through this, we have to tolerate this because there's going to be some positive outcome in the future. And all that rationalization does is it allows us or puts us in a situation where we create excuses for keeping ourselves in a situation that we don't want to be in. And so that's another thing we need to stop. So we need to make sure that we're looking for them, that we're not blinded. We need to make sure that we're not just rationalizing and allowing ourselves to be in that situation. Now, the third thing is fear. Sometimes we see the options that we have. Sometimes we know that would be the best situation, that it would be best for us to go ahead and shift and try something new. But sometimes we're stopped simply because of fear. We are afraid of failure. We're afraid sometimes of success. We're afraid of doing what we need to do to change our situation, whether it's to talk to our boss about a change that needs to be made or looking for a new job, whichever the case may be. Sometimes we're stopped simply by fear. And we did a previous podcast some time ago on fear. And then, in fact, my closing statement on the podcast of forget to be afraid comes from that. We need to not allow fear to keep us from achieving goals and from becoming the person that we want to become. We need to overcome fear and forget to be afraid. So if we have these three reasons why we tend to allow ourselves to stay in these uncomfortable positions where we feel trapped and feel as though we have no escape. How do we overcome it? Well, there's a few ways I think that we can work on that. The first is really through an examination, and that is critically looking at your situation and taking some of the emotion out of it, because a lot of times emotion will cloud some of these decisions and it will cloud what we're trying to consider. So take emotion out of it and focus on the situation itself. What is it about the situation that's either the right thing or the wrong thing? And look at it critically. Sure, it may be that things are bad right now, but just around the corner, this entire position is going to change, and it will change for you. And in those kinds of situations, sure, it may be worth going through this uncomfortable time to get to that benefit. Most of the time, that's not the case. But it's through that critical examination that we can look and see what it really is, what the position really is, and whether we should stay in it or not. The other thing that this examination does is an examination of yourself. Sometimes we just have unrealistic expectations. When you are in a job that you are uncomfortable with or that you don't like, and you think, well, I should be the boss. I should be an assistant manager by now. I should be in a position of leadership. I should be in this kind of relationship or that type of relationship. Meanwhile, you're 19 years old. You have absolutely no experience with anything. It may not be realistic to think that in that position in life, you should be a manager, or that you should be in leadership. You have, if you have no education, if you have no training, if you have no experience in that kind of position, that self-examination to say, am I really being realistic about what I'm expecting from myself? I think is a really important aspect to overcoming some of those limitations that may keep us in the position of feeling trapped. The second thing is perspective. And I think that a really good exercise that I encourage people to do often is, if you had a friend in your exact situation and your friend was telling you what you say to yourself or what you feel yourself, what would you say to your friend? What would happen if you shifted that perspective and you were talking to somebody else about it? Would you tell your friend, you know what, just stick it out, it'll be fine? Or would you say, you need to make some changes. You need to look for something else. You need to get out of that relationship. You need to quit that job. You need to look for this or do that. What would you do if it was somebody else that you cared about that was in your situation? Many times we keep ourselves in situations far longer than we would encourage our friends or people that we cared about to stay in them. So shift that perspective a little bit and see what you would say to a friend or a relative or loved one. The third thing is to look for support. Talk to somebody else. You were just in a situation where you're talking to, looking at yourself to see what would you tell your friend in that situation. Now, talk to a friend. See what they say to you. See what your friend or a loved one or family member or someone would advise you. Talk to them about how you feel about things. Do you think that this is good? Do you think that it's realistic to stick this out for this potential? Do you think I should make this change or that change? And get some of that support. Many times what we find is getting support like that from other people not only makes us feel more comfortable making change, but it also offers support. So now we know that when we're making this change, when we're taking this next step that we're going to talk about in just a second, when we're taking that next step, we have somebody that we can go to and say, remember we were talking about this the other week. Well, I did it. I need help. I need to talk to somebody about it. I need to problem solve some things with somebody. I need some support as I'm making these changes. So talking with somebody else, either a professional, a coach, a counselor, a therapist, or just a friend, loved one, relative, anyone, just talking with somebody else, especially if somebody else with some similar experience would be great. And the fourth thing, you've looked at the situation, you've looked at yourself, You've shifted your perspective now. You've talked to somebody else and you've gotten some support and some information and guidance from others. You got to do it. The fourth step is you got to take the plunge. You just have to make the decision. In 2008, I was still at university and I was working and I was unhappy, but I was driving 45 minutes there and 45 minutes back every day to work, frustrated. I would get there, 5 or 6 o'clock in the morning. I would leave at 5 or 6 o'clock in the evening. I would bring work home. I was overwhelmed, frustrated, unhappy. I talked to a couple of other people. I did some of these exact same steps. And I did it. I decided that I was going to take the plunge, and I left the university and joined a private practice much closer to home that allowed me to do some of the things that I really enjoy doing, which was the clinical work and my forensic work. At the same time, I talked to a friend who was working at another smaller university that didn't do research, but they just did teaching, because I, of course, enjoy teaching as well. And so I hooked up with them so that I could work as an adjunct instructor and started teaching. So what I did by talking and getting support from other people is I was able to leave that job, still do most of the things that I really enjoy doing. I could still write, I could still see patients, I could still do my forensic work, I could still teach, I could still do all these things. But the stress was relieved because now I had control over all that. I had control over my schedule. I had control over how many classes I taught. I have control over how much writing I do and how many patients I see and how many cases I take. I was able to take control of that. It was probably one of the most challenging things I ever did because I had talked about it probably for 5 years before I actually did it. But taking that step changes everything. Taking that step, it was difficult, changed everything. And then I was with that practice for a while, talked about starting my own practice. Again, that stress, that worry, that no, you know what, this is safe, this is comfortable, this is where I need to be, all this is taken care of, all that's taken care of. And then in 2014, I just did it. I said, that's it. I'm going to do it. And I started my own practice. It's been challenging at times. But since then, I've been able to start my podcast. I've been able to start my YouTube channels. I've been able to do my Twitter and all of my social media stuff. I've been able to do workshops. I've been able to write for the newspaper. I've been able to do a lot of other things because, again, I'm gaining more and more control over my life. Now, I've had a lot of that control before, and maybe I didn't see it. And I had opportunities before that, again, maybe I didn't see, maybe I didn't explore the way that I could have. But when we feel as though we're taking control of our life, when we feel as though we're eliminating those things that keep us trapped, that keep us confined, that can make all the difference in your life. That can open doors that you didn't even know were there. So look for them. Talk to people. If you're unhappy in your relationship, talk to people. Look to see what your real options are. If you're unhappy with your job, look at what your options are. Look at what else is out there, what else is available. What else can you do with the skills that you have? And begin to explore that. Begin to expand your social networks and expand who you have contact with and see if there's other options out there. There's lots of availability. There's lots of options. We just have to look for them and try to connect ourselves to the people that can help us get to where we need to get. We have to do the work. We have to be the one to take charge and have to do it. We don't have to do that alone. We can do it under our terms, in our own way, but we may need the help and support from others. So, all right, don't be trapped. Don't leave yourself stuck in a situation where you're unhappy, depressed, stressed, overwhelmed. Expand your world, look for those other opportunities, and then take them. Do it. You can do it. I believe in you. So, all right. Thanks so much for listening. Until next time, I'm Dr. Berney. Have a great day and forget to be afraid.